Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm delighted you could be with me for this next segment. I'd like to spend a few minutes to talk about in-office procedures and selecting where you will have a plastic surgery procedure. In general, I see more and more people in my office, whether we call them patients or customers or clients, they want things done in the office or in the surgery center or even the hospital, but in an outpatient setting. In other words, they don't want to stay overnight in the hospital or surgery center. If possible, they want to have things done in the office. Now, of course, we still maintain the option and offer the option to people to have an overnight stay at the hospital or the surgery center. But more and more people seem to want the so-called in and out surgery or day surgery, where they come in and have something done and then they go home afterwards. So what I'd like to do is to take a few minutes to talk about options of where to have the surgery, the different anesthetic options that we offer to people, and to talk about outpatient versus inpatient procedures. First of all, there are three general localities or generalizations, general places where we can offer to people to have a plastic surgery procedure, such as a blepharoplasty, which is an eyelid tuck, a neck lift, or even a short scar facelift, for example, a mini lift, etc. There are many procedures that can be done at one of three places. Let's start by talking about the office. For people who want to have a plastic surgery procedure in the office, they come into the office, they get an oral sedative, that's a pill. It's an oral sedative or an anxiolytic. Anxiolytic means that it's a medicine or a pill that relieves anxiety, so they can calm down and relax. It can also have some sedative properties. So number one, they come in and they can take an oral sedative or anxiolytic. Number two, we can offer them an oral painkiller or narcotic, so they can take that by mouth. Thirdly, we can give them an antibiotic by mouth. Once we do that, we allow those medicines to take effect. We allow a person to become relaxed. We allow some of the painkiller or narcotic to take effect. And of course, the antibiotic is distributed throughout the bloodstream and throughout the body quite quickly. And then we start by numbing up a patient. For example, if we're going to do the natural neck lift, neck and jowl lift, I start by numbing up a person. We numb up the skin with a needle. Typically, I use a combination of lidocaine and marcaine. Marcaine is like a longer acting lidocaine. So I numb up the skin. Now, when the skin is numbed up, then I numb up the deeper tissues with something called Hunsted's formula. That's essentially the same solution that we use to do liposuction. So it numbs up the deeper tissues. It's a very dilute, buffered numbing medicine, or a very dilute lidocaine. And we do that and we numb up the deeper tissues. So we let that soak in or take effect. So let's review. A person has taken oral medicines. We've numbed up the skin. We've numbed up the deeper tissues. So the goal is the person is relaxed, numb, but awake. So it's not a general anesthetic. It's not even an intravenous sedative. So that's in the office. A person can come in and take pills by mouth. We let them take effect. Then we numb up the skin. Then we numb up the deeper tissues. And we allow those medicines to take effect, and then we can start. So typically we can make a patient quite numb. Now they're not asleep, so they're still aware. If we speak to them, they're still aware of maybe some tugging and moving and some pressing, etc. But there should be no true pain or no true discomfort. We offer that option to people who have a certain psychological makeup that they're capable of relaxing in the office while something is being done. There are certain subset of people, and of course I'm not judgmental, there are a certain subset of people who maybe they're antsy, or maybe they can't sit still, or just the idea of a needle makes them get the jitters. So for those people, we typically recommend that they have a different level of anesthetic at another facility. say we go downstairs to the surgery center. But within the office, we can do things like a neck lift. We can do eyelid tucks. We can do short scar facelifts. We can do small areas of liposuction. We can do lumps and bumps, remove moles, etc. I've even done some carpal tunnel releases in the office, or as I said, I've done neck lifts. Sometimes people will want extensive surgery done, say for their face, and we will bring someone in on successive days, like 2 days in a row or even 3 days in a row. So we can do a lot of work. In general, I like to keep the length of a procedure to 4 hours or under in the office. I think after about 4 hours, most people will get a little antsy and they want to move around, or they might want to get something to drink or to eat, or they might want to go to the bathroom, etc. So I think in general, for the office, a patient who is capable of relaxing and keeping still and just communicating if there's a problem or an issue or they're feeling discomfort, who can be numbed up and who can relax, and to have a procedure done in the office. And this can be done just as well, the high quality, safe procedure. We have monitors in the office. We can check someone's oxygen saturation of their bloodstream and their pulse and their blood pressure, etc. And we can speak to people while they're having something done. So that can be done very safely and effectively in the right patient. Now, I prefer that people with multiple medical problems or uncontrolled, say, hypertension, or if they're diabetic, or if they have a history of a heart condition or lung condition, that we do those procedures either at the hospital or the surgery center. I think for the office, people need to have controlled blood pressure, and they need to be quite free of uncontrolled medical problems. I think safety first. We don't want to do anything with a patient that might place them at risk. So that's the first level, is in-office procedures. Now let's go to the second level. At the surgery center, and I'm fortunate that in my building here in Monterey, on Monroe Street, we have a certified, licensed, and accredited surgery center, Monterey Peninsula Surgery Center, right in the building on the ground floor. So the next step is to take a person to the surgery center. Now, you recall that I said a person can come in and take an oral sedative, an oral narcotic, and an oral antibiotic. Now, at the surgery center, they start an intravenous line, which is like a little needle, a little catheter that goes right into a vein that can be placed in the forearm, in the arm, or even in the hand. And right into the vein, those same medicines can be given: a sedative, a narcotic, and an antibiotic. So the same medicines can go right into the vein. We have an anesthesiologist there, another doctor tending to the patient. We have a nurse, we have a circulator, we have a scrub tech, and the patient can tell the anesthesiologist how deep they want to go. They can get sedated lightly, they can get heavily sedated, they can have a twilight anesthetic where they're sort of almost asleep, but they can wake up and speak if need be, or they can just totally go to sleep. That's called a general anesthetic. Now, even under a general anesthetic, there can be different levels. An anesthesiologist can use a breathing tube for someone and put them under quite a deep general anesthetic, or they can use something called an LMA, or a laryngeal mask anesthesia, where they don't place a tube down their trachea, but it's a form of a mask that goes in the mouth to help them breathe and keep the airway open. So there's many different levels, and a patient can discuss those levels with their anesthesiologist and just tell them how deep they want to go. Now, in my practice, when I do procedures, even though a patient gets an anesthetic, I still like to numb them up. I still use lidocaine and Marcaine. I use the needle, of course, but then they're sedated or asleep, and that doesn't bother them. Some people believe in subconscious pain, some people do not. I tend to think that preventing discomfort is much better than treating discomfort. So before I make an incision, I want a person numbed up anyway, even though they're under anesthesia. I will oftentimes add another medicine to the numbing lidocaine, to the numbing medicine called epinephrine, and that helps constrict the blood vessels so there's minimal bleeding during an operation. And that's really what we want. We want a patient safely monitored, comfortable, numbed up We don't want bleeding, and we want to do an operation safely and effectively to give them a high-quality result, high-quality operation. Now, of course, anything done in the office is done under outpatient. People come in, have something done, and go home. The next step, as I said, is the surgery center. Typically, that's in and out surgery, or what we call day surgery. A patient comes in, there's a preoperative evaluation that takes about 45 minutes or an hour, and they're prepped, and the intravenous is started. They meet the nurse, meet the anesthesiologist, etc. Then they undergo the operation at the level of the anesthesia that they choose. Following that, they're monitored in the recovery room, say for 45 minutes, an hour, sometimes 2 hours. Following that, they can go home right from there. They do not have to stay overnight. Now, we are able to offer to patients that they can stay overnight if need be. If they're having an operation done that's covered by insurance, oftentimes the insurance company will reimburse them or pay them for that overnight stay. If it's a cosmetic or plastic surgery operation, there is a charge to the patient, but they do have the opportunity to stay overnight in the surgery center if they want. We tend to do that for more extensive procedures or longer operations. So we talked about the office, we talked about the surgery center. What's the next level? The next level is to go to the hospital. Of course, I have privileges at Community Hospital here in Monterey. I'm the chief of the plastic surgery division. Plastic surgery patients, whether their operation is covered by insurance or if it's a completely cosmetic operation, or at times we'll do a combined operation where we do some procedure that's covered by insurance, a different procedure that's covered not by insurance but that's completely elective cosmetic. We can do that at the hospital. So at the hospital we can do operations under sedation, or we can do operations under general anesthesia. Typically for patients that need careful monitoring, if they have medical problems, we'll do that at the hospital. Now certainly at the hospital we can do outpatient surgery. In other words, they come in, get prepared to go to the operating room, have a procedure, and then go home after being monitored in the recovery room. They can go home, but they also have the opportunity to stay overnight in the hospital. There's something called a 2359, which is when a patient stays in the hospital under 24 hours, 2359. They have a special arrangement, special financial arrangement to stay under 24 hours. So once again, the 3 levels that we offer, 3 locations that we offer for people: in the office, at the surgery center, or the hospital. And with each patient, I'm a big advocate of a custom designed approach. We want to put together a surgical plan for a patient based on their desires, their comfort, safety, to offer a high quality experience for that patient. If you'd like more information about plastic surgery or where to have your plastic surgery procedure done, I'm Dr. David Morwood. I'm here in Monterey, California. My phone number is 831-646-8661. I'm at drmorwood.com on the web, drmorwood.com. That's D-R-M-O-R-W-O-O-D, drmorwood.com. Thank you so very much for joining me today. This is Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. Thank you so very much for being with us.